Why are people catching COVID-19 this summer? Insight into the uptick. Just as summer gatherings begin, Americans are also catching COVID-19 again. Cases predictably rose, in upticks, during the winter with more people indoors. They are also increasing as experts expected at the start of summer. Centers for Disease Control and Prevention data shows small jumps in hospitalizations and deaths and slight increases in new cases. This latest rise in cases shows how the virus has persisted 4 years since the start of the COVID-19 pandemic. When you begin to see a pattern, you then might say it's becoming endemic. Dr. Jessica Justman, a professor of epidemiology and medicine at Columbia University, told USA Today, "When something is endemic, that does not mean it's going away. That means it's staying around." Another common endemic disease Americans have learned to prevent routinely is seasonal flu. SARS-CoV-2, like any virus, is constantly mutating, so it can infect more people and survive. New variants and subvariants expand outward like branches from trees, each with different mutations seeking to adapt. As the changes happen, health experts and officials have responded with vaccines and other protections to reduce the risk of serious illness or overwhelmed health systems. COVID-19 new vaccine for fall should target genome lineage, not variant, FDA panel. COVID-19 increases. The upticks from the latest subvariants are nowhere near levels the US experienced in 2020, or when the Omicron variant began to drive cases and deaths across the globe in 2021. Hospitalizations and emergency room visits are far less frequent this season than in December. Deaths have not reached the levels of this winter, when more than 2,000 people died from COVID-19 each week in January. In the latest CDC estimates as of June 15, fewer than 150 people died of COVID-19. Cases are driven by consistency in a collection of subvariants known as FLT, named for the mutation's technical names. FLT derives from the genome variant, descended from Omicron, which dominated cases until the spring, according to the CDC's nowcast loose estimates of circulating variants. Now, FLT increasingly causes cases in the US. The largest is the KP3 subvariant, which accounts for about a third of cases, followed by KP2 and KP1.1, SAG's data showed. Ulbone, derived from genome, also accounts for a substantial portion of estimated circulating variants. Bird Flu CDC unveils dashboard to track bird flu as virus spreads among dairy farms. The western US and Hawaii have experienced increases in recent weeks, CDC data showed. However, wastewater samples, a surveillance tool to detect COVID-19's spread. Across the US appear to show increases in the virus spread. Michael Osterholm, director of the University of Minnesota's Center for Infectious Disease Research and Policy, said a portion of the new cases involve the FLT variant. However, he noted that the US lacks good surveillance this late in the pandemic. "It's fair to say that there is an increase," he said. "What we don't know yet is how much it's going to be. Is FLT more transmissible? FLT may be more transmissible, partially because of mutations that make it easier to shield the virus from antibodies, according to Andy Pecos, a professor of molecular biology and immunology at Johns Hopkins Bloomberg School of Public Health in AQ&A in May. But it doesn't seem to cause more severe illness or present different symptoms. Vaccines provide protection against COVID-19, though they may wane over time. The last vaccine in late 2023 targeted the XBB.1.5 variant. In February, the CDC updated its guidance for people 65 and older to get a booster of the current vaccine. In early June, a Food and Drug Administration advisory panel recommended vaccine makers to target the genome lineage. A new round of vaccines is expected in the late summer or early fall. People experiencing respiratory symptoms should reduce the spread of the virus by staying home. They should also contact health providers for treatment if they're at serious risk of illness. Experts continue to recommend wearing a mask and distancing to reduce transmission of